Schizophrenia by Devon, Jenkins, and Kenzie.
Schizophrenia is the most devastating disorder of the human brain, affecting 1% of the world's population.
About 1 out of every 25 people have this illness.
Right now, there is about 2.2 million people living in the United States with schizophrenia.
Some of the symptoms include hallucinations and disordered speech, believing in things that aren't real, and increased thoughts of suicide.
You have an increased risk of getting this disorder if someone in your immediate family has it, if your mom had certain problems while she was pregnant with you, including malnutrition, viral infection, or took a certain medicine, or if someone in your family has a disorder like it, or if you have problems with drugs or alcohol.
Some of the risk factors for having this disease is mostly genetics. Also, having an older age of the father, or taking mind-altering drugs during teen years and young adulthood.
While not all the causes are well known, some of the suggested causes are if you're a twin, if you live in a stressful environment, if you have abnormal brain structure, genetics. All of these are important to check out if you are at risk.
There are many ways that schizophrenia can affect your health, which include relationship problems. Relationships can suffer because people with schizophrenia often withdraw and isolate themselves. Paranoia can also cause a person with schizophrenia to be suspicious of friends and family.
Schizophrenia could cause a disruption to normal daily activities. Schizophrenia causes significant disruptions to daily functioning, both because of social difficulties and because everyday tasks become hard, if not impossible to do. A schizophrenic person's delusions, hallucinations, and disorganized thoughts typically prevent him or her from doing normal things like bathing, eating, or even running errands.
This disorder can lead to alcohol and drug abuse. People with schizophrenia frequently develop problems with alcohol or drugs, which often used in an attempt to self-medicate or relieve symptoms. In addition, they may also be heavy smokers, a complicating situation as cigarette smoke can interfere with the effectiveness of medications prescribed.
This disorder could cause an increase in suicide risk. People with schizophrenia have a high risk of attempting suicide. Any suicidal talk, threats, or gestures should be taken very seriously. People with schizophrenia are especially likely to commit suicide during psychotic episodes, during periods of depression, and in the first 6 months after they have started treatment.
There are ways to try to prevent this illness from happening. These include having the mother take vitamins and be healthy while pregnant, getting exercise and regular checkups, and not having kids over the age of 40.
This chart shows likelihood of you getting schizophrenia based on where and when your mom gave birth. This chart shows that the older you get, the more likely you are to be diagnosed with schizophrenia in male and female. Treatment for this disorder varies on the seriousness of it. Some of the treatments that can help are positive attitudes, communicating with your doctor, therapy, setting goals, talking to family members, staying involved, support groups, and taking medication. Myth: schizophrenia refers to a split personality or multiple personalities. Fact: multiple personality disorders is a different and much less common disorder than schizophrenia. People with schizophrenia do not have split personalities, rather, they are split off from reality. Myth: schizophrenia is a rare condition. Fact: schizophrenia is not rare. The lifetime risk of developing schizophrenia is widely accepted to be around 1 in 100. Myth: people with schizophrenia are dangerous. Fact: although the delusional thoughts and hallucinations of schizophrenia sometimes leads to violent behavior, most people with schizophrenia are neither violent nor a danger to others. Myth: people with schizophrenia can't be helped. Fact: while long-term treatment may be required, the outlook for schizophrenia is not hopeless. When treated properly, many people with schizophrenia are able to enjoy life and function with their families and communities.